Good morning and good afternoon. My name is Samuel Bro, and welcome to this 15th webinar on workplace mental health. And so before we begin, it would be great if everyone could introduce themselves through the chat function, which can be found on the right of your screen. As shown on this slide, you'll see that if you do not see that chat box, scroll to the top of your screen and a chat option should appear. This is where you can ask questions or make comments, either during or after the presentation. When asking a question, please send them to all participants, which can be found in the drop-down menu beneath the chat screen. I also want to mention that this webinar is being recorded, so it can be archived on the MHCC website following the presentation. A French version of the slides will also be available in the coming week or two, and due to the large number of participants today, you're all on mute. If you have a question for me only, please send it to the host, which can also be found in a drop-down tab in the chat function. And so today we have a very full presentation ahead with 4 speakers, and so I'd like to introduce you to all of them. And as I said, my name is Samuel Bro. I am a program manager in workplace mental health here at the Mental Health Commission, where I oversee strategies for the public sector, labor and unions, as well as some outreach to the province of Quebec. Also joining us today, we have Neville from Excellence Canada. Catherine is a senior executive who has extensive knowledge of quality management systems. She's a very active coach with a focus on progressive excellence, including related strategies, as well as process improvement. She's currently the Vice President and lead coach at Excellence Canada. We also have MacDonald from Manulife Essential. Chris is currently at the Assistant Vice President of Wellness, Absence, and Disability Services in the Group Benefits Division at Manulife, and she has over 30 years of experience in this area. Chris is also part of the project team for Manulife's participation in the Commission's case study project that is currently showcasing industry champions as they adopt the Workplace National Standard. We also have Meg Petkoff from the Hamilton Wentworth Catholic District School Board. Meg is a speech-language pathologist and has been with the Hamilton Wentworth Catholic District School Board for over 34 years. More recently, she's been involved in the development and implementation of the board's Respectful Workplace policy. She's currently the Respectful Workplace Advisor, and her portfolio includes coordinating the board's Mental Health at Work initiative for employees. And finally, but not least, we have Rhona Dunwell from Human Resources, or rather, who is the Human Resources Manager. Rhona Dunwell has been an HR practitioner for over 17 years and is currently the Human Resources Manager at North York General Hospital. Rhona is passionate about strategic people practices, and she currently proactively supports the hospital in health human resources planning. And so to give you an overview of the day, I would like to go over the agenda, not the day rather, but the hour. We'll go over the agenda and then get going on the content. And so to begin, we'll go quite briefly over the National Standard for Psychological Health and Safety in the Workplace, which really sets the conversation today and part of Excellence Canada's Mental Health at Work program as well. Then Excellence Canada will go over their program, followed by an overview of 3 different experiences related to the program, and then we'll conclude with a question and answer period. And so I'll pass it over to Catherine to tell us about their journey with Excellence Canada.
Thanks, Sam, and good morning, everyone. I'm delighted to be joining you this morning and having the privilege of joining your other speakers as they share their impressive journeys with you today. Our mission at Excellence Canada is to help improve organizational performance and to recognize excellence. We're very lucky to have impressive partners. Our founding partners are wonderful organizations from across Canada, many of which are involved in our various excellence programs, including, of course, our mental health at work. At Excellence Canada, we develop and maintain globally competitive, proven standards for organizational excellence. And we do that with input from our clients, in a very collaborative way so that they can be the best standards possible to meet our clients' needs. We also, in terms of approach, we also provide training, coaching, assessment, and tools to implement, validate, and in a separate division, of course, certify organizational excellence. We recognize organizational excellence through the Canada Awards for Excellence program. And as you can see, we offer a number of programs. We're very privileged that the Honourable David Johnston, Governor-General of Canada, is the patron for our Canada Awards for Excellence. And we have them in a number of areas, including our Order of Excellence, our highest award, Excellence, Innovation, and Wellness, Quality, Healthy Workplace, and of course, very importantly, Mental Health at Work. Now, speaking of our award winners, we're very, very proud of all our winners, of course, and proud to count 3 very special pioneers who achieved the Mental Health at Work Canada Award for Excellence this year. They include North York General Hospital, whom you're going to hear from later in this webinar, and at the gold level include Bell Canada and our host, the Mental Health Commission of Canada. So hearty congratulations to all organizations, and particularly those 3 today. And now I would like to introduce our Mental Health at Work program with sincere thanks to Manulife, who is the champion of excellence for mental health at work, and who is also here today to share their journey. The mental health at work requirements serve as a roadmap to encourage, support, and implement exemplary mental health programs. They are based on research and knowledge regarding factors that impact employee mental well-being in the workplace, as well as the experiences and positive outcomes of successful organizations. They're based on the 13 psychological risk factors from Guarding Minds at Work, and our certification program and Canada Awards for Excellence program provide third-party verification and valued recognition for your organization and all its wonderful staff. Now, when we look at the National Standard of Canada for Psychological Health and Safety in the Workplace, many of the same people were involved in the development for mental health at work, and we're absolutely delighted to be collaborating with organizations looking at both. Now, we look at the mental health at work and ensure that it has aligned to the national standard, and provide progressive implementation steps so that organizations can implement this while they're doing their day job. They can also look at implementing our mental health at work standard while achieving psychological health and safety in the workplace in a way that is sustainable. So we certainly adopt and or exceed requirements of the national standard, and we use our program that's written in a progressive way to help organizations implement their mental health at work program, and in many cases also look at a more comprehensive healthy workplace. Speaking of which, I would like to give you a sneak preview of our model for the new Healthy Workplace Standard, which we plan to launch in January of this year. And you can see the importance of the profile as one of the quadrants being mental health and workplace culture. We all know how important that is, and we're very proud to be involved with this. Now, in terms of the mental health at work program itself, it's comprised certainly of requirements. We have a guide to help guide, instruct and guide people. The patron for this program is Michael Wilson, and we're absolutely thrilled with that. And the program links to the Canada Award for Excellence. There's 5 key drivers in the standard. One is around guiding principles that foster and support mental health in the workplace. We look at leadership that demonstrates clear commitment by creating a culture, values, and overall direction for mental health in the workplace. We look at planning that helps people with their improvement initiatives, monitoring, evaluating, and reporting on those things. We look at people engagement in terms of how people are treated, encouraged, supported, and enabled to contribute to the organization's overall success. And last but not least, we look at process and risk management, ensuring a disciplined and unified approach towards analyzing and solving process problems, because we know all these things are linked. Now, if we take a quick look at the model itself, and I'm careful around time, there are 4 progressive levels in the model. They're all focused around continuous improvement, looking at assessing, planning, analyzing, and refining work as organizations move forward. So again, as you can see, we look at the foundational level, then advancement, role model, and through to world class. Typically, it takes 3 to 5 years or more to implement a full journey because, of course, this is a journey. It's not a race. It's not about the final destination. It's about all the good work that you're going to be doing as you progress through the stages. Now, when folks are generally beginning their journey, you may find on the next slide, you're going to find that folks are very often on the left-hand side of the page. I don't know if any of you can identify with this, where there's multiple commitments and objectives and priorities, and sometimes that in itself can lead to a great deal of stress in an organization. So very often when they start on the left side, what we find is with this framework, it helps to align your initiatives to focus on one crisis at a time. We're all very busy people, and we find that this is very helpful for organizations. So if we look at the next slide in terms of why folks use the mental health at work framework, we look at it as providing the right things to think about, and not in an arrogant way, of course, but by that we mean there's a focused approach, and we're looking at things through the lens of the standards so that we can progress effectively one level at a time. And of course, we know that implementing a program for mental health at work is so much the right thing to do. And your organization, with all its staff, can feel very proud of its achievement as they progress through the levels. And speaking of achievers, I'll finish on that slide. Speaking of achievers, I'd like to move over now to the first of your very wonderful speakers today, Chris MacDonald from Manulife. Thanks for your time.
Thank you so much, Catherine, and also to Samuel. I'd like to also welcome all the participants on the webinar and call today. It's exciting to have you certainly join us today. I look forward to sharing a little bit about Manulife's journey, and what I can say at this point is we very much are in the early stages. So just a little bit about Manulife. We've been established. We've been in business for well over 125 years now, since 1887. From the group benefit side, we actually touch 1 in 5 Canadian employers, and every week we actually have over 250,000 Canadians that actually connect in with us in various different benefit areas. But more importantly, why I wanted to focus in on today was that we actually have 11,000 employees across Canada for Manulife, and we're, I should also comment that we're in more than 20 countries, and that comes into play a little as I explain about our objectives. So one of the things today I was asked to provide was a brief summary of our journey, and just in adopting the standards, as well as actually beginning our journey towards certification with Excellence Canada specific to the Mental Health at Work program. So here's a look at what our journey has looked like so far. I should give you a little bit of context. Last year, in early part of 2013, we went through a major restructuring, and there really was an opportunity to look at being able to create a formal strategy or enhance what we were doing at that time. When I say we went through restructuring, it wasn't just at the Canadian level, it was across globally, and that really does impact that 20 countries that I was talking about. So we wanted to really look at a consistent approach that we would have that wouldn't just be looking at the Canadian division, but what opportunities could we look at in considering cross-border application as well. So some of our objectives, or our objectives in the project, were really it was essential to ensure a healthy environment exists and it's sustainable going forward, that we aligned with current organizational needs necessary to attaining strategic objectives, as Catherine had noted earlier. This really was an opportune time for us to create and introduce an overall strategic framework to implement across our organization. We very much are committed to implementing the standard, but also the Mental Health at Work program and certification through Excellence Canada. Why I say phased approach, I'll explain that a little later, since we're such a large organization as well. We really did want to consider reviewing the cross-border application, and most important, we wanted to make sure this was a collaborative, multi-stakeholder approach that we share between our human resource area and external client-facing business units, such as the one that I belong to. You know, the business benefits are very similar to other organizations that we have. They align actually with the benefits noted in the standard, and I'm just briefly just going to say it's around, for us, recruitment and retention. We want to ensure organization excellence and sustainability, and certainly cost effectiveness. We have some opportunities. There's always opportunities, no matter what your instance is related to absenteeism and presenteeism and workplace accidents or drug and health. There's always opportunities, even if you have low incidence in that. And then finally, risk mitigation. That was important to us as well. So our 2014 journey so far has included a number of key elements to it. The first that was really key to us was making the standard, I would just say, relevant to our business organization and our culture. And that really did mean gathering and ensuring that we had senior leadership support. Why I put executive summary is it's been really key to really learn making sure that we're getting the relevant points to our senior leadership and the support. And what we developed with that was actually a two-page executive summary in trying to bring down what did the standards mean to us and how important that was and what were our objectives through this project. And the second part was ensuring we had an initial core working group, some key questions, what was the purpose of the group, you know, we identified our resource team, and we did some launch and project planning. The next key elements of what we've established in 2014 so far was really not just the Mental Health Commission case study research project being part of that, which we started at the beginning of 2014, but was also alignment with the Mental Health at Work Excellence Canada project. So we were trying to look, not trying, what we're working towards, I should say, is both at concurrently and how best to do that efficiently. Communication strategy was key to it. We have completed a baseline assessment, and I'll talk about our pilot group. So moving forward, as we went into this, key drivers to our project approach actually included these 5 elements. But even before starting with these key drivers, we needed to establish guiding principles, which I'm going to actually cover which our guiding principles to these projects, to this project were. We needed to have that commitment and leadership and participation. That included a business case and a 2-page executive summary that was easy to reference for the senior leaders as we were speaking to them. And I can honestly tell you from our leadership team, it's always been about it's the right thing to do. It makes sense. It has not been a significant, a huge barrier in getting their attention related to this. They've all been certainly on board with this. The next part to it was about planning, and that really was a current state review. We had a lot of good things in place, but what did we need to do? We needed to ensure we had a good baseline assessment. That was absolutely key for us to move forward. And then the next stage was around implementation, the people engagement, ensuring that we identified promising practices, the gaps and opportunities, but we recognized we needed to work with a smaller group to engage and debrief and work with team champions going forward. Then the 4th stage there, evaluation and action to close gaps. You know, we're not there yet as far as our journey. We're really into the planning and implementation pieces with the pilot group. So that will come next, we recognize that, and then into the management review where we're reviewing process, risk assessment, and what can we do to improve. To us, it's a perpetual cycle, and we're quite excited about this as we start out on this journey. The next slide really was around establishing our project governance, roles and responsibilities. And so we have executive sponsors. We have 2, one from our human resources area with Stephanie Kingsmill, and we also happen to have Rick Burnett, our executive vice president from our institutional area in the Canadian division. So what we identified was the need for 2 co-executive sponsors. And in addition to that, we have a steering committee as well as a working group. The working group is about 12 to 15 members, and it has they have subject matter experts, and they really work to move the project and tactical plans forward. Just into the next piece, I talked about the guiding principles, how important it was for us. And for our organization, we really did want to keep it simple. As Catherine had mentioned, there were many things, there's many things on our plate, and we really wanted to keep it simple, be collaborative, leverage the resources that we have, and certainly have a targeted approach, very focused approach. The guiding principles also needed to dovetail with other initiatives that we have on the go, such as the HR policy harmonization, change management initiatives. And we needed to consider what was already in place and build on that. Take steps at the pace that our organization and culture could manage. And I know we all say this, but it is a journey, not a race. And how for us can we put this into bite-sized chunks for people to actually implement, and we can get feedback on it. So the next slide around it was absolutely key around the communication strategy. A key term for us is socializing the project, socializing mental health at work, what that means, and mental wellness, and really identifying what our commitment was and putting that statement out there. What's the project? What does it mean? What stage are we at? Launching the pilot, regular communication updates, and we're also looking at and have started roadshows to really socialize this. We recognize it's just a really key element or step to really make sure that people understand what this is to be able to incorporate this into our culture. Then I talked a little bit about the baseline assessment. This has already been completed for us during 2014, but it was key around three key areas around the documentation. What were our mission and value statements? What policies and procedures do we currently have in? Program and benefit descriptions. All of that has been compiled, and being able to, identify where mental health or mental wellness is addressed in it. Organization-specific considerations, certainly around what are our key success metrics, what metrics do we have out there, and trends that we could pull from. And then finally, employee engagement. And we do an engagement survey just about every year. If it's not 12 months is 18 months, and it's being able to bring that back to capture the feedback and incorporate into action plans as well. So what we have in place right now we're working on is our pilot group, just a phased approach where we recognized we needed to focus on increasing awareness, reducing stigma, and reducing any gaps that were identified, such as an understanding about what mental health is or mental illness. And certainly reducing stigma within the workplace. We also wanted to have the flexibility to meet with our smaller teams in person. That face-to-face really helps a lot in gathering feedback. It was also an opportunity to quickly obtain feedback regarding processes and approach, and part of it is including, and we will be launching with the employee group, the Guarding Minds at Work survey. And applying our guiding principles so that we have practical bite-sized initiatives that are easy to implement. We also can use this as part of starting the conversations and opening up discussions, as I said, in bite-sized segments at team meetings. And it's not meant to be a whole team meeting. It's meant, the entire duration of a team meeting, but maybe you could have a good 15 minutes with regards to that, getting information back and forth. What else have we done during the year to actually introduce and just to socialize this a bit more with the employee group? The organizational level, we had our business case for leaders and individuals. This is our second year in the Not Myself Today campaign, and we certainly saw some great participation and greater discussion from employees. We had our mental wellness workshops in place from our hosted by Homewood Health. And then we also had a health risk assessment campaign, which we just finished with over 2,200 participants that took place during a 5-week period of time. So key learnings so far, we did find it was important to keep it simple and relevant. We had to learn what our elevator speech was. It was important for us to create a 2-page executive summary about what the standards are and the importance for Manulife. It was socializing, we recognize, takes time. It's not a one-hit wonder. And it was taking advantage of the coachable moments with leaders, with employees and senior leaders so far. And gathering feedback we found critical at all times and at all levels. So overall, it's a journey, and I keep saying that over and over to our group that we're working with. It's definitely a journey for us. It's not a race. So at this time, I just would like to pass the torch, as per se, over to Meg for her presentation. Thank you.
Pleased to be able to speak to the group in regard to the Hamilton-Wentworth Catholic District School Board and our journey through Excellence Canada and mental health at work. Our organization is composed of over 4,300 employees. We have 29,500 students, 4 admin sites, and 48 elementary schools with 7 secondary. So we have 59 sites altogether that we, in fact, are working with in terms of implementing the standards. Our philosophy is that the culture and the manner in which we treat people of all genders, abilities, and disabilities is rooted in our beliefs and the gospel values. One of the challenges we have is that we do reach across all 59 sites with different administration. We have merged our goals with the Ministry of Education's Student Mental Health Initiative as appropriate, and this has worked out really well for us. We have employees asking for more information and support as these initiatives are rolled out. We also have, in terms of what has helped us significantly in regard to our organization, is that we believe that our employees, as well as our students, will reach the fullness of their human potential in an environment where the promotion of mental health and wellness is prioritized and protected. And this is one of our fundamental beliefs and has been truly the anchor that we've used in order to promote our program. In terms of how we began our work, we certainly looked at the fact that if you look at the business case, the workplace as well as personal life can certainly create significant amount of stress for individuals. We certainly have talked about the fact that one environment influences the other, and we've looked at, from the point of view of some of our statistics, our absence and attendance statistics, issues that address or issues that reflect burnout, depression, heart disease, all those physical signs and symptoms of stress. And then we've looked at the organization under stress in terms of, and what that looks like in regard to high absenteeism, diminished productivity, performance concerns, potential conflict, decreased talent retention, and diminished public reputation, and made a commitment that, in fact, what we wanted to promote and work toward is that psychologically safe organization. We know that our employees who feel safe and well in their environment will be the most effective in whatever their work assignment is. So for those classroom staff, their wellness directly impacts the program delivery. And we certainly have made the case that sick care is a lot more expensive than proactive prevention. And again, based on our philosophy of wanting every employee and student to be able to function to their highest capacity within their environment, it's very consistent with what we're trying to do and what we believe in as an organization. In terms of what prompted us, we began to look at some of the challenges that we had through the HR department, and one of the things that seemed to come through as a theme was, reticence. And essentially, we looked at the fact that when you're reticent to address a situation, say employee performance, because you suspect a mental health concern, there's potential that by ignoring it, it may worsen and impact more people. And we really talked to people who were struggling with this and found, they had some insecurity about addressing concerns, and they really identified the need for more training and education. And that's where we began to work with Excellence Canada, and that's been tremendous from our perspective. We did form a leadership committee, and we pulled in people from all employee bargaining groups, senior administration, as well as human resources. Certainly we did have a little bit of pushback initially, and pushback from the perspective of some of our senior management team questioned whether or not we would be able to manage dedication to moving through this program and dedication to providing the kind of support we needed to do in order to accomplish our goals through the program, as well as, at the same time, the fundamental work that we were hired to do. In essence, we replied to that by really looking at the data. So we looked at statistics, requests for information, and the need to look at our policies, both in terms of policy development and review, as well as our procedures. And we wanted to essentially look at whether or not we were an organization that was typically reactive or we had a proactive approach. And we really wanted to focus on the fact that the proactive approach was the one that we were looking to be able to incorporate, as well as the reactive approach. So our goal was to look at the culture, the leadership, the management, and look at how we could renovate all of those areas to be responsive to what our needs were to promote a mentally healthy workplace. So in terms of the culture, we were looking at a culture that was supportive and affirming, leadership skill development, that looked at emotional intelligence, that looked at servant leadership, collaborative leadership, management that really was able to differentiate between leadership and management. How do we address and support people in terms of policies, practices, and procedures? And, you know, what do we need to change in order to, in fact, shift to a mentally healthy and supportive workplace? We engaged Excellence Canada, and it's been absolutely a wonderful journey. What I personally like about it is that it is a progressive program that does provide you with step-by-step template, and that template is research-based. It has a lot of flexibility, so it allows for customization based on organizational needs. And everyone at Excellence Canada has been tremendously knowledgeable, available to respond to questions, make suggestions, and affirm our progress and encourage our continuation of our journey. So it's been great. In terms of our goals, in terms of the mental health initiatives for students, we have looked at, again, combining our employee goals as well as our student goals. And our goal is to increase awareness of mental health and wellness programs and services. We're looking at building capacity both in terms of our staff that work directly with students in schools as well as our human resource staff. We look at decreasing stigma and establishing clear pathways for support. And in doing our review, one of the things we determined was that we need to review the EAP services that we have available to our employees and their families, and the kinds of services and support that we can provide that will be relevant. In terms of level 3, we're looking at walking the talk. So people engagement for us is and continues to be a priority. And we have a number of people who are championing our cause. It is a big undertaking. You know, we really look to that motto, the journey of 1,000 miles begins with the first step. Not that this is 1,000 miles, but that it does take time, and it is really important to walk through each phase so that you can create sustainability. We have teams of employees involved. It's one of the committees that we have on a board-wide basis where everybody shows up because there's that level of commitment and concern and engagement. We have, in fact, we're in our 4th Guarding Minds at Work survey results. We work from the template. We certainly solicit employee input and feedback. We try to run our staff and student initiatives in parallel. And we gain from looking at the data we have from our benefits attendance patterns, some of the work we do in return to work and again, our EAP program, as well as the respectful workplace data. We really believe that we're making great progress. This is our third year, and we've done a number of seminars in recognizing signs and symptoms of mental health challenges in the workplace, how to address and support employees and our responsibilities under the Human Rights Code, Psychologically Safe Workplace, Bill 168. Our committee is strong and doing really well in terms of meeting and in terms of providing input, resources, and guidance that come from the grassroots employees in terms of what their needs are. We're working hard to develop policies and protocols and to make them responsive to both our legislative requirements as well as the input and feedback that we get from our employees in terms of what's going to be supportive of them. We're redesigning our EAP program to make it more responsive and look at services that will be delivered to people that support them in their workplace as well as in their home lives. We've redesigned benefits packages. We've created a wellness center, and we've provided classes and sessions in topics such as mindfulness, meditation, prayer meditation, compassion for caregivers, yoga, vision boarding, laughter yoga, so things, again, from that proactive perspective that will be supportive of our employees' wellness. We have strategic communications through our board website. We have created a section called My Life, and that's where we post all of our information for our employees. More and more people are engaging and really coming on board in terms of seeking information and really wanting to provide support to the program as well as to their fellow employees. You know, the change doesn't happen overnight, but we certainly have been blessed by having people who have been very committed to the program. When we look at sustainability, we're really looking at our program goals influencing behavior within the workplace, decisions that are made not only on site but administratively at that more global level. We're looking at influencing policy, influencing day-to-day operation, and of course influencing trust, which is significant in terms of any kind of cultural change. And we've been really pleased with our journey to this point in time. So thank you very much, and I will pass the microphone over to Rhona.
Thank you, Meg, and thanks, Sam. Thank you to everyone. Thanks for the opportunity to provide this short presentation on our mental health at work journey. By way of background, we are one of Canada's leading community academic hospitals. We've been around since about 1968. Our services include acute care, ambulatory, and long-term care services across 3 sites. Our mission, providing exceptional health care to our diverse communities, supports the hospital to deliver excellence in everything that we do. Our vision to lead the pursuit of excellence through learning, innovation, and partnership is grounded in our values of respect, integrity, excellence, and collaboration. We have over 5,000 staff, physicians, and volunteers who are all committed to patient and family-centered care. Some of our recent accomplishments and awards include accreditation with exemplary standards, being named one of Canada's 10 most admired corporate cultures. We became a smoke-free organization in 2013. We received the Healthy Workplace Award in 2013, the Quality Healthy Workplace Award 4 years in a row from 2010 to 2013, and very recently the Mental Health at Work Award, Bronze recognition. So with respect to our journey, our commitment to a healthy workplace has been clearly articulated within our people plan. And our plan is to help our people be the best they can be in all areas of their life. Now, in our second edition of our people plan, which was published in 2013, we indicate our commitment to a healthy workplace, one that ensures optimal health, wellness, and safety for staff, physicians, and volunteers, through the development and evolution of a culture that supports employee health and well-being. With respect to our journey, the foundation of our journey started with at the very high level, with our strategic plan for 3 years from 2012 to 2015. And that includes a culture as a pillar and people as key enablers. Our 2013 to 2016 People Plan, the second edition, articulated our people strategies to support staff, physicians, and volunteers to act as catalysts for our hospital's strategic success. And we used a principled approach to optimize organizational capacity and individual capability, which was consistent with the learning organization. A healthy workplace is a core element of our people plan. The other core elements include diversity, leadership development, total rewards, learning, and workforce planning. The people philosophy articulates that North York principles supports the evolution of our culture of engagement and support each person to be the best they can be. The principles include fostering a culture of shared accountability and learning, demonstrating respect for all, and promoting a holistic approach to ensure optimal health, safety, and wellness. Our senior leadership team and Board of Governors are committed to occupational health, safety, and wellness of all employees, physicians, volunteers, as set out in our policy and in practice through endorsement of our annual organizational health plan. So since 2010, we've embraced the OHA's Healthy Workplace model as the foundation for our journey towards a holistic approach to organizational wellness. And the framework really guides our strategy in creating and sustaining a healthy workplace. And these three drivers from the OHA frameworks include a safe environment where there's a focus on the workplace, job characteristics where there's a focus on the individual and supports healthy lifestyle and practices, and a strong culture or organization in which we aim to keep staff engaged and happy. And in addition, we embrace the mental health at work model, which has the 5 drivers of guiding principles: process and risk management, people engagement, planning, and leadership. Now, a holistic approach to workplace wellness recognizes that a healthy workplace must address mental, emotional, social, physical, and environmental needs. Each year we have a major deliverable in addition to numerous wellness objectives, and in 2014 the focus was on mental health. Our wellness plans use the above frameworks, and from these awards and data from engagement surveys, people metrics, EAP, benefit utilization, short-term and long-term disability rates, we continue to evolve in our journey to excellence. Now, our goal is to continue to enhance mental health support, illness prevention, and anti-stigma initiatives, and develop a very robust and holistic mental wellness program. And this is all embedded in our culture and in our strategy, and we continue to find ways to enhance our all of these initiatives into our culture. So going forward, some of our focus will be to identify opportunities to work on opportunities in areas that were identified by Excellence Canada to get us to the next level where we become role models and demonstrate best practices, and by increasing awareness and build into our culture all of our mental health initiatives. So again, our plan follows the OHA framework and takes into account Excellence Canada's mental health at work model based on the national standards for psychological health and safety in the workplace. Currently, we engage staff through several diversity workshops using the pillars of celebration and culture, religious competencies, and organizational integration. Our program includes various mental health promotion initiatives and introduction of health risk assessments. We've added new standards, the new standards into our Occupational Health, Safety, and Wellness Policy in 2013. We conduct EAP seminars with topics including emotional eating, dealing with conflicts, happiness, sleep, parenting, critical incident debriefs. We promote education seminar to staff through our addiction series, or mental health, anti-stigma, mindfulness-based interventions through our in-house physicians. We have a Reach for the Stars event and an annual wellness fair. And our annual wellness fair only reached the day staff. So our Reach for the Star initiative is geared specifically to our evening and night staff in order to bring wellness and education to them. We also have a recognition program and conduct biannual engagement surveys. Now, some of our best practices are set out in our application. So, for example, in our guidance principles, we have our people plan, as was earlier mentioned. Under leadership, we have a leadership development and talent management program and leadership forums. Under planning and programs, we have extensive wellness resources for staff, mental health awareness week, wellness fair, etc. And again, our people engagement surveys. Recently, there was the creation of a healthy workplace advisory group to increase people engagement and champion wellness programs. We also conduct health risk evaluations where we identify high-risk populations, promote self-care and education, and plans to monitor psychological health and safety risk index using engagement survey data. We also have a great partnership with our mental health program, and through our education series, we continue to provide education and learning to staff throughout the organization in an effort to really embed mental health at work into our culture. So in terms of evidence and metrics, our 2012 and 2014 engagement survey data results were very favorable and were higher than the OHA averages. Our vacancy or recruitment and retention rates, again, are very favorable and is higher than most of the targets that we've set for the organization. Our vacancy, workforce stability, and average sick days figures are favorable to OHA Region 3 75th percentile rates. We are committed to continuous improvement with plans to monitor psychological health and safety index using engagement survey data and an ongoing basis. Our EAP reports are reviewed on a regular basis, and we monitor utilization and try to identify primary issues and come up with ways of addressing these issues. So this slide captures our continuing journey to excellence in sustaining a healthy workplace, with mental health being a key component of a holistic approach to organizational health. And some of our focus going forward will continue to be your health and safety risk assessment, as well as looking at opportunities to continue to embed mental health into our culture as we look forward to attaining the Mental Health at Work Silver Level Award or recognition. So some of the strengths that were identified through our recent verification and opportunities for leadership, opportunities for to develop, were to build mental health awareness into our health and safety structure, can continue to integrate mental health into our training, and target mental health programs for leaders. Continue to ensure strategic and operational plans are in place for mental health through our people plan. To integrate evaluation and review process for mental health, again, into our people plan. And given the 24/7 nature of our operation and shift work, continue to identify and remove barriers to staff participation in wellness and mental health programs. In terms of training, engage more heavily in early stage mental health awareness and training, and develop targeted leadership training on workplace mental health. In terms of our process management and risk assessment, to continue to develop integrated risk matrix to manage physical and psychological risk, and to involve employees in teams to assess psychosocial risk and hazards in the workplace and within their own area of work.
Thank you so much, Rhona. As you'll see on the next slide here, just wanted to show a picture and a shout out to your great work, Rhona, from the North York General Hospital, accepting the bronze level recently at Excellence Canada's Award. And of course, I would be remiss if I didn't show a picture of our own reception of the gold level award for the Mental Health Commission's work on the implementation of the national standard as well. So for those who were very tentatively listening, you would have noticed that I really skipped quickly on the national standard, so much so that we barely saw any slides. But since time is flying by, I just wanted to point out that for those who want more information, we just launched this week, fresh off the press, a new implementation guide for the standard. And so this literally provides step-by-step guidance for those that are looking to implement the standard or looking for more information and more guidance as they implement the standard and embark on the journey to improve workplace mental health. And so we did have a few questions from the audience, and I would like to jump off directly back to Rhona to see if you would have any examples around anti-stigma initiatives, and someone asked if they could get more information around the Reaching the Stars initiatives, if they can get in touch with you.
Absolutely.
Okay, and could you provide just a bit more context around some or examples of what some of your anti-stigma initiatives would have been?
So Dr. Unger is our Chief of Psychiatry, and he's been really kind of the leader in building anti-stigma awareness. Northside General participated in one of the campaigns and really brought to the forefront, had engaged some of the units, the mental health department and other areas as well in the hospital, engaged them and really brought to the forefront the awareness campaign, and also he's working on some what's called reverse shared clinic, and really that's bringing I guess so patients with mental illness can come and go to, just like we all can go to our primary care provider for appointments. Patients with mental illness can also go right into their primary care provider and get help with mental health disorders. Other anti-stigma, there's a lot of education seminars around that provided by our mental health department, and everyone can participate, as well as just during the grand rounds, there's various topics on that. And also our diversity program has seminars that speak specifically to different, not just stigma with mental health, but you know, we have the LGBTQ series and different cultures, awareness and education around all the different minority populations.
And some of that we will be happy to share with you if you would like to contact me.
Great, thanks so much. And I wanted to ask Catherine, going back to the beginning, we had a question around socializing mental wellness in an organization, and wanted to know if you could elaborate on that. And I'm going to link it to another question where someone was asking, how do you do that with very limited resources or funds?
Sure, absolutely. Happy to help, Sam. I think there are a number of ways to do it. We have a couple of different levels of programs, number one. So we have our, the excellence journey around mental health at work. We also have mental health at work essentials, which is a smaller commitment in terms of time and resources for those organizations who may be a little bit challenged around resources, either in terms of human or financial. I think the other thing in terms of, shifting towards, wellness, psychological health and safety with a low budget line is really focusing on awareness and learning and building on the good work that others have done, much of which you have just heard a great deal about from the other speakers. In terms of tools and resources that we would suggest, generally speaking, we suggest that you connect with Excellence Canada and speak with either myself or certainly our subject matter expert, which is Karen Jackson on mental health, and so that we can learn a little bit about your strategies, resources, and so on, and then work with you in terms of some planning, and not all big and bad, but some basic planning around how you might approach this, look at a gap analysis against the standards in terms of your organization, identify training as required, and then provide ongoing coaching. So it can be as big and as small as your resources and time allow, and we're happy to help with any of that.
All right, well, thank you so much, Catherine. So that leaves us with pretty much, that was the last question, I believe, because we're running out of time. And so if we'd like to continue the conversation, I'd encourage you to go on our Collaborative Spaces, which is an online repository and conversation place for mental health in Canada. There we share mental health information with others and learn from others as they post. The more you contribute, the more robust a resource it will be. And there is a resource section made for workplace, and so you can just select workplace. There's also a resource for caregivers. And so you can join us by going to mentalhealthcommission.ca/English/spaces. Our next workplace webinar will be on January 28th because, of course, most of us will be off for the holidays. The topic for the next webinar will be about implementing the standard from a subject matter expertise and legal perspective. And so we'll be joined by Lauren Bernardi from Bernardi Human Resource Law Professional Corporation. Before we go, I wanted to thank all of the speakers. Truly, it's been such a great experience to hear about your experiences as you implemented the standard within your organizations, but more importantly, wanted to thank Excellence Canada for organizing all of these presenters and for helping us, move the journey forward in terms of workplace mental health. And so I'll ask everyone to take the time to fill out the survey that pops up on your screen as you exit the webinar. It will help inform the topics in our future webinars. And so I'd ask that before the next webinar, feel free to email me directly if you have any questions. And as always, we thank you so much for your participation. And a reminder that the presentation will be made available online within about 3 weeks' time, and that you can also watch it on our YouTube channel. So thank you so much. Have a very good and safe day.